Hey, this is Yasir coming with another interview for Detailed Fitness, and I'm here at Atlanta Natural Health Center with Dr. Chelsey Drda, and she's a doctor of chiropractic. And so we're going to talk about what is chiropractic and what is not, and things of that nature. So first, I want you to introduce yourself and tell us who you are, more about you.
Hey everybody, I'm Dr. Chelsey Drda. As he mentioned, I've been a practicing chiropractor for about 5 years now, 2 here in Atlanta, and I primarily focus on working with women and children, but I love working with all adults. I really think that people have forgotten what health truly is. So here at Atlanta Natural Health, we empower people to make informed health choices and to take health into their own hands so that they can live better lives.
Good. And I actually found Dr. Drda, and we call her Dr. Chelsey, so you'll hear me say Dr. Chelsey more so than Dr. Drda. But it's definitely a friendly environment that here at the office, and I found her through a bartering association that I'm in, and I was having problems with tingling and numbness in my hands, and so I was looking for a chiropractor to assist me in relief for that. And I've used chiropractic care for off and on for over 20 years, and it works. And my main thing is I want to know what is chiropractic. What people have this idea about it, but you tell us what, define it and explain it, how it works.
Yeah, absolutely. So in its simplest form, chiropractic is the study of the spine and the nervous system and evaluating how that contributes to disease or just even variations of normal. So people kind of pause when I say that because they think, well, if it's not disease, it's normal, right? But the World Health Organization actually defines health as complete mental, spiritual, and physical well-being, and not simply the absence of symptoms. So I tell patients all the time, for example, sometimes the first symptom of heart disease is a fatal heart attack. So we know that we're not always healthy, even when we think we are. And sometimes pain, numbness, tingling like you've experienced are the last symptoms to show up. And there are symptoms that happen long before that that we don't necessarily think about because nobody teaches you about the importance of your nervous system growing up.
Right.
Nobody says, hey, you know what? You need to know that this is a brain issue or this is a spinal nerve issue, not, oh, that's just normal, it'll go away. Your nervous system's telling you something for a reason. So chiropractors look at that, and then we remove interference from that nervous system via chiropractic adjustments so that you heal yourself.
Okay, well, speaking of adjustments, when you get an adjustment, you may feel some popping, and what is that? What is that sound?
I'm so glad you asked, because a lot of times people come in where they're like, I'm a little bit nervous about the popping and the clicking. I make sure to tell my patients I don't use the words crack or pop because those imply that something's wrong, and actually the sounds that you may or may not hear are relative to how much gas is trapped in a joint. So it's a little bit childish, but I call them bone farts because that's really what they are. It's gas escaping the joint when you're getting an adjustment, and sometimes you'll hear it and sometimes you won't. It depends on how much is moving and how much gas is trapped, and depending on the age of the person, because of course kids don't get adjustments similar to adults. They're much more gentle and they don't involve that same kind of rigorous motion, what we call a high velocity adjustment. It's not the same thing.
Okay. Now, in terms of movement, how much movement is done when you adjust someone?
Very minimal. Very minimal. We're talking about millimeters worth of change here. Your spinal bones really don't move a lot. They can only twist and slide very small gradations. And we know that those millimeters worth of change are enough to cause nerve dysfunction, but certainly we're not moving them any more than that because that would be harmful and we don't want to do harm. And our goal is first do no harm. We want to help people.
Okay, good. Well, I want to circle back around to my care because, like I said, I came here for the numbness and tingling. So can we elaborate, kind of just talk about a little bit about what you found when you treated me?
Sure, absolutely. So I think it's important to understand that nerves carry a lot of functions. They carry the functions we need in order to live our lives, right? Anything from organ function to blood flow, so many different things that we don't think about, and pain is only 20% of the nerve. So pain sensation or anything we can feel, including numbness and tingling, is only 20% of that nerve function. So a lot of times there's a lot of other things going on with that. So for example, in your case, since you've allowed me to speak specifically about it, there was rotation of the bones in the neck, but also some of the bones in the upper back, as well as changes in the shoulder, the elbow, and the wrist. So sometimes the nerve can get trapped in multiple sites in the body, not simply the neck, but obviously what we care about the most are the problems that are most central, because given enough time, even if we just were adjusting your neck, that numbness would get better. But certainly a lot of chiropractors will also address other issues as well, like the shoulder, the elbow, the wrist, to make sure you're healing faster.
Okay.
Yeah, remove as much interference at once as possible.
Right. Well, by the way, the numbness and tingling is gone. It took a while just because of the adjustments in time. And that's one thing I like about the chiropractic care. So is you're actually looking for issues. You know, you feel numbness. Some people just want to take a drug. I was taking some medicine to kind of relieve the pain, but they wasn't working. And I knew that I needed more than just some pills or some kind of shot, because a lot of times people want to recommend a shot, cortisone, things of that nature, and that would be a last resort for me. So in that frame of mind, who is chiropractic good for and who is it not good for?
Sure. So the answer is everybody. And that sounds kind of cheesy, but I feel like chiropractors are like dentists, and we are essentially spinal care doctors and nervous system care doctors, but we are for wellness. And certainly people can seek us out for specific complaints. I have people come and see me for asthma, allergies, kids with colic, kids with breastfeeding issues. And I don't treat any of those conditions specifically, but it just so happens those are the symptoms they come in with, or they might have neck pain, back pain, numbness, sciatica, things like that they've heard chiropractic is good for. But really, it's health and wellness for everybody, from preterm, before birth, all the way through, our later years of life. So it's really good for everybody. Like I said, I don't treat anything other than changes in the spine that have to deal with nerve system dysfunction, but certainly it's applicable to anybody and everybody.
Wow, that's pretty wide range. Now, how does chiropractic care relate to allergies? You mentioned allergies and asthma and things like that. How does that relate?
Well, I can personally speak to the changes I've seen with my allergies, and of course I'm just a little bit congested this morning, but I used to be somebody who I would have tissues stuffed in my pockets, in my backpack, in my desk. I had them everywhere because I had seasonal allergies year-round. They told me I was allergic to ragweed and dust, and I was always having sinus issues. And come to find out, I actually had some interference with what's called my atlas, which is the top bone in your spine. I call that your master circuit breaker, because it's something that anytime we have a significant amount of stress, it goes out of alignment and it causes changes to our spinal cord, as well as some of the nerves in our upper back that are related to stress. And in particular, those were impacting my lungs. So I had allergies and asthma more than I ever should have. So through chiropractic care and also through some dietary changes as well that removed some toxic interference from my nervous system and what we call a chemical stressor, my allergies are virtually gone. You know, I might have a little bit of congestion in the morning, especially if I have a little bit too much butter, but my goodness, what a life-changing experience. And that's not just myself. I've seen that in my younger patients, even those without food allergies, and several of my mentors as well as reading plenty of chiropractic literature about that. So the answer to your question is, when the nerve system is doing what it's supposed to do, people heal themselves better. That's really what it comes down to. We heal ourselves and the body functions better.
Oh, great. I'm a witness to allergies as well. I've had, it's kind of because I've gotten away from treatment, so I've noticed the increase in springtime, because I suffered really bad from hay fever at one point, but I noticed when I started getting chiropractic care, it diminished. So I was able to blend the two, like, oh, this is the relationship between the care and my allergy symptoms. So I definitely can witness to that, the treatment making an improvement.
Good.
But getting back to, you mentioned about the arm, and being that I'm in detailing and do a lot of manual labor and repetitive motion. So how often would you recommend chiropractic care for someone, maybe not as something severe what I was suffering from, but someone who does the type of work that I do, manual labor, not just detailing, but some manual labor?
Yeah, absolutely. So the thing I love about people who do manual labor is even though they're at a higher risk for injury and overcompensation, like overdeveloped muscles from certain motions and things like that, I really believe that they heal better because they're moving their bodies more. So usually my people who are doing manual labor, unless they have a specific injury or a specific complaint that's come up, they come in every month to 6 weeks usually, and some of them even as often as every 3 months or so. And again, the reason is because they're actually using their bodies. So even if there's an issue that's come up, it's able to self-correct better than somebody who sits at their desk all day and isn't using their bodies the way we were meant to.
Okay. Well, stay active. That's the first thing. Be active, get active, and that relates to the exercise. So you see the exercises on the Detail Fit group. So definitely try to incorporate some of that into your lifestyle. If not those, something else. But definitely get active.
Yeah.
And we're in Atlanta, of course, but if they're looking for a chiropractor, what would you recommend they look for? Who, type of person, the doctor that should they look for?
Yeah, so that's a complicated question because I think a common misconception is that all chiropractors are the same, and in fact we're radically different, just like people in the detailing world, just like people in medicine, just like restaurants. Even if you have a chain, so to speak, you're not going to get the same experience at everyone. So generally when I'm looking for doctors for my patients, I look for somebody who if they can, takes insurance or offers affordable cash rates. We don't actually offer insurance in my office, but we offer plans that help people to be able to afford their care. So I would look for a family practice, because if somebody works on kids, they definitely take a more gentle approach to chiropractic, as well as looking at the person as a whole, which is really important. And then it kind of comes down to what's your who are you as a person, because it's really important for your chiropractor to meet you and match you. And if the personality isn't a match, this is true with really any professional relationship, right? Whether it's in networking or otherwise, including other healthcare providers. If you don't like or trust the person you're working with, they're the wrong person. Right. So I do empower people to ask about a consultation, ask if you can come and meet them, get a tour of the office before choosing care. That will often give you peace of mind and say, okay, this is the provider for me.
Yeah, I like that. Definitely, you have to blend, have to match, get along, and respect one another. So, I definitely would highlight that. Now, for those the people that are here in Atlanta, how can they reach you and get a hold of you?
Yeah, absolutely. So the easiest place to find me is Instagram. It's at Atlanta Natural Health, very basic. Same on Facebook, at Atlanta Natural Health, or at atlantanaturalhealth.com. We try to make it easy. We try to make it simple for people. We're on Buford Highway, right by the CDC and PDK Airport. We just want to be accessible to people and help as many people as we can.
Well, I thank you for your time. It was enlightening for me, and I hope it was enlightening for those who are watching. And let's go get some treatment. See you next time. Thank you so much. Have a great day.
Thanks, guys.